Vaccine coverage is a challenge in most countries and in many different contexts. And the problem is that we don't know what the causes of under-vaccination are in different contexts. We don't understand whether it's mostly to do with practical barriers to vaccination, what we call access factors. And what I mean by that is transport costs or when clinics are open, practical difficulties for families to get their child immunised, versus what we call acceptance factors, so concerns about vaccination. And in order to tailor vaccination campaigns and develop strategies to improve uptake in different contexts, we need to be able to accurately diagnose the causes of under-vaccination. We've recently been given a large grant by the Australian government to develop what's called the Vaccine Barriers Assessment Tool, or VBAT, which is the first tool of its type that will accurately measure both access factors and acceptance factors. So this tool we anticipate will have both a short form, so a 5-question survey, and a longer form, around 15 questions. And we see this tool being able to be used in population level surveys to measure vaccine sentiment over time. So for example, to be put in annual population health surveys, or to be able to measure the impact of vaccination campaigns or the impact of vaccine interventions as part of clinical trials, or even in dialogue, in conversations with providers and parents who have concerns about vaccines. So we really see this tool as being able to be used in multiple different ways to really drive strategies to improve confidence in vaccines, uptake and acceptance, by really understanding what the causes are. So in terms of the longer form being used by a provider, so for example, a parent could complete the 15-item questionnaire in the waiting room, or it could be sent to them before their immunisation appointment or well-child visit, so that the provider has that information before the consultation to understand what concerns the parent may have, what barriers there might be to vaccination, to really be able to tailor that conversation. Because that's what we really find is useful in talking with parents who have concerns, to understand the degree of concern, what the concerns are, how both parents might feel about vaccinating their child, to really be able to make the conversations more effective and ultimately to have the best impact, which is to vaccinate their child. So the VBAT, or Vaccine Barriers Assessment Tool, will be developed in Australia and New Zealand. So it will be in a more high-income setting, but we do hope that it will be able to be generalised to other high-income settings. It's going to go through a very rigorous stage of initially sort of item development, cognitive testing, and then psychometric validation. And we're fortunate in both Australia and New Zealand to have immunisation registers, so we can actually validate the tool against uptake, not just intention, but actual behaviour. So it's going to be very rigorously evaluated. And then in the third phase of the project, we're actually going to look at the tool and how it performs in some of those areas that I mentioned before. So essentially developed for Australia and New Zealand in the first instance.